if you want to learn the 4 common mistakes that physical therapists make when designing strength and conditioning programs for athletes, this episode is for you. Hi, everyone. Welcome back to the podcast. Welcome all new listeners, and welcome back to those who have heard my content in the past. You cannot miss today's episode. Today, if you want to learn the 4 common mistakes that physical therapists make when designing strength and conditioning programs for athletes, this episode is for you. Before I go on to the podcast, what is new? What is latest and greatest? Life is phenomenal. It's a great word, phenomenal. I am currently prepping for quarterly meetings. Whenever you listen to this recording, it is in April, and every quarter I review with my team just progress, performance reviews. What is it that we need to do to ensure that everyone is successful and they're growing personally and professionally? That is a big deal to me. So just keeping everybody on the same track and keeping them accountable, including myself. So that's what's new. Just a lot of prep work. Life is great with the fam. Kids are back in flag football, and we just finished soccer. So keeping them moving, and yeah, life is great overall. All right, on to this podcast. Why am I doing this podcast? I get that question often. Why am I doing this podcast? There's a couple different reasons. Coming off of, for those of you who attended my sports PT accelerator course, and managing acute injuries and how to work with pro athletes and elite athletes on the acute side. If you have not listened to my content in the past, you'll understand that I see rehab as a bell curve, in that PTs typically are really good from week 4 to about month 4 to 6, meaning we typically see and manage people from week 4 of injury, or week 4 of injury to about 4 to 6 months, maybe either post-op or whatever it is. But most of the time, that's kind of our wheelhouse. And a lot of times, the 0 to 4 weeks, from time of injury to 4 weeks, that's where we lack confidence, maybe because we don't see it as often. Maybe we don't have training on it. So for those who took my accelerator course, that's what we reviewed: the first 4 to 6 weeks of injury. How do you manage somebody with a fresh ankle sprain, literally from day one all the way back to a sport, not just after 4 weeks or whatever it is on crutches? No, like you being an active participant in deciding what that looks like, assuming no fractures or anything else that needs a bigger workup. So that was that portion of the accelerator. And as I taught that, we then got into, well, what happens at week 12, 14, 16? What about the strength and conditioning side? When do you push them? And that wasn't the focus. And so it kickstarted a lot of great conversations. So I wanted to follow up with that. And we talked about what people typically do and the common mistakes that they do early in their management of acute injuries. And one of the biggest thing we talked about was that they try to apply chronic pain principles to acute management. It's actually nearly the opposite on how to manage this. So now, as we talked about strength and conditioning, I wanted to segue right from acute injury. We know how to manage people chronically. What can we do on the right side of that bell curve? How do we push them from acute to, maybe you manage them chronically, whatever it is, and then get them stronger? I think as a profession, we talk about wanting to keep people strong, wanting to keep them in wellness, wanting to get them in strength and conditioning programs, in return to sport programs, and all those other things. But one of the conversations we talked about at the accelerator course, and people were open and honest, is that they didn't feel confident and comfortable taking them beyond a certain point. And really because we don't get that opportunity as often. And so I want to give the 4 common mistakes that I see PTs apply when designing programs for athletes. And maybe everybody's story and everybody's perspective is going to be a little different. It can be, well, I work in a strength and conditioning facility. Good for you. Well, I don't have any access to strength and conditioning. That's a different story. Or you maybe are in part of your community and maybe you're not a strength and conditioning coach, but you have access to really good coaches. And no matter what, this podcast is perfect for you if you're a clinician who works with patients and athletes and you want to get better on that other side of that bell curve of designing programs for people, maybe developing the relationships, maybe looking at the tactical side of how do I create a better one, or I'm already advanced, what else can I be doing? all of that is going to be the same in this podcast. You can generally apply any of these principles to wherever you are, whether you're just starting or you've done it for 50 years. I don't care. The same principles exist, and you're going to love this concept. So that is why I created this content. Ultimately, you have to understand where you are along that spectrum of practice, and your years of practice don't dictate application of certain things. It just matters how much experience you've had with athletes in this domain. So I don't know if you've been practicing 10 years but don't have much practice in strength and conditioning, or you're a new grad and you have tons of practice because you were in a clinical rotation that did it, or you're out of school for a few years and you've had some experience and now you have some relationships. So let's talk about them. Let's talk about these 4 common mistakes. What are they? All right. The first and foremost that I notice, and I mentor a lot of PTs. I've done it in the past. I'm doing it now. We have phenomenal physical therapists at Sports Performance. And ultimately, one of the biggest things I think that I've seen across the board, doesn't matter how many years experience, is at the top level, we treat on an island as a physical therapist sometimes. Generally, you're only seeing them, meaning you might not see, you're seeing their ankle, you're seeing their knee, you're seeing their back, and maybe you see how they move and how the application goes to their sport. But beyond that, you fail to see how your application of treatment and plan coincides with their off season, in season, preseason, and looking at their entire calendar. A lot of PTs that I've talked to, they don't even consider that. So they apply the same, 10 to 15 reps, 2 to 3 sets, whether they're in season or out of season or preseason. It doesn't matter. They're doing the same reps. Why would you do that? It's about specificity. So typically in a season, if they're in a year-long season, and depending on the sport, it's going to be different, but the principles are the same. Let's take football, for example. All right, American football. For the physios listening to this in different parts of the world, okay, American football. There is preseason, maybe late summer or in the summer going into August, and they're in season from August to December, and you might have playoffs and Super Bowl in January going into February. And then there was an off season from February through June, May, where players now go into OTAs, usually I think in April, May. So there's really about a 2-month off season, February, March, and then I think they might go into OTAs in May and June. So ultimately, there's about a 2-month period where they're off. Then they're in spring, a little bit of spring training, preseason, in season, and then they're off. So now you have to say, okay, well, if somebody sprains an ankle in December, how are you managing an ankle sprain differently in December than you would in July? It's a very different game. Why? Because December, they might be starting playoffs and they're in season. What if this player cannot miss a game? How do you change that? How do you change strength and conditioning? They still have to maintain some type of strength. Or if they're in July, what are you doing with the strength and conditioning programs? How are you modifying or adjust that? Because they still, no matter if they're in an ankle sprain and they still need to keep conditioning and they play this weekend or the following, or they're going to be out for 2 games, how do you maintain conditioning? How do you maintain strength? How do you maintain flexibility? How do you maintain balance on top of rehabbing their injury? And so you have to see where they are along the spectrum. So are they in season? Are they out of season? Or are they preseason? Your rep scheme, you have to look at 4 variables: the frequency, the intensity, the time, and type of training that they have. And you're going to adjust those variables according to where they are. So in season, what do you need to keep high? Their intensity needs to stay high because they have to keep their intensity high. But the problem is maybe they have an injury and you can't have intensity on that injury, but their nervous system needs to stay high. But if they're in off season, you don't have to really worry about intensity. You can build up their volume. Maybe you can change up the type of training that they have because you're in off season. So these variables are things to consider. So number one, where are they along the spectrum of being in season, out of season, or preseason? Before you answer any other question, you have to know that first. So the next time you're rehabbing somebody, ask them, tell me what your season looks like. It will be one of the most game-changing questions you will ask anybody, and they'll be like, oh, you know what you're talking about. Actually, I do. I have a game in 2 weeks. That changes the game with the type of programming that you're going to have for this person. And I'm not just talking about uh, corrective exercises. I'm talking about programming, meaning everything but the rehab. What are they doing from a strength perspective to maintain the strength that they had pre-injury? What are they doing for their conditioning while they rehab? What are their recovery days? Are they changing the time of training, total time of training, the type of training, the frequency or the intensity? That's outside of corrective exercises. That's what I'm talking about, not just the 2 sets of 8, 4 sets of 6, whatever combination you're dealing with on that day. So first common mistake, they fail to consider the timing of season. Now, number 2 goes along with that, and I mentioned that they fail to accommodate the variables of training according to the time of year. So meaning, when you look at volume, the amount of sets and reps someone does, in out of season and in preseason, that volume might be higher. In off season, they might be completely just resting. In their preseason, that's where they're probably going to be picking up the volume of training, meaning maybe in their spring conditioning, they're just trying to build some mass. I need to gain some muscle mass. So my reps and schemes are going to be based on hypertrophy. So I'm not going to be doing 15 to 20 reps generally, and I'm not going to be doing 4 to 5 reps. I might be doing 8 to 12, 6 to 10 reps to build hypertrophy to gain some size. Or is their goal to gain strength? Maybe they're not looking at tempo-based exercises. So the tempo might be a variable that they're changing. Maybe they're just doing some bodybuilding. Great. Doing some, gun show stuff. Great. But are they looking at generating strength? Are they really looking at bench, squat, deadlift, whatever their variable is? That's a different story. You're going to be building up the volume of training during that time. So as a rehab professional, you kind of need that synergy of the rehab process to align with the volume of training. So in season, their volume of training might be lower because they're practicing more. Their volume of actual strength training will be generally lower, but their intensity might be higher because they're outside training, doing the thing that actually is their sport or career. Now we're talking about elite athletes here, but the same could be said for a high school, collegiate. It doesn't matter. The principles are the same. Their volume of training for their sport is going to be higher in season, so their volume of training in their strength and conditioning will likely be less generally. In their off season, they're not training for their sport as much. They're training to build resilience, gain some size, because we know in season, a lot of times people lose muscle mass. They lose total weight. That means that their force production will drop. Mass times force is going to be, your mass is going to be a huge influence in your ability to produce force. Because if I have less mass, that's less force being applied. So generally, you need to generate, create, and maintain the strength to accommodate that. So ultimately, you have to decide where are they in season and accommodate those variables accordingly. So what happens to your volume and intensity based on the time of year? Now, we talked about that. Off season, they're likely higher volume. Preseason, dropping the volume. And in season, lower volume, higher volume of sport and everything else. So the volume of actual strength training and technical training in general will be inversely proportional. So you're going to have higher volume of strength training and dropping as you go in season, and the volume of conditioning and sport specificity is going to go the opposite direction. So this is a general framework. And ultimately, all it does, it puts more arsenal in the way that you plan and prep for your athletes. That's ultimately what you need. That's it. So number one, they fail to consider in-season, out-of-season, preseason. Number two, they fail to accommodate volume and intensity according to their time of year or their training of the year. All right. So the next piece is, now that you have that idea, you know where they are from a training perspective, you accommodated those things. The next error I see is, oh, darn it, I built up this training program and they did everything. I knew where they were in the time of year, and they come back to me more sore. They're more beat up. They haven't been able to recover. Why? Because you failed to consider their ADLs, their work responsibilities, and the training outside of that with their strength coach and their technical training with their technical coach. Those big four variables change how much volume you can add in. So if they're off season, they might be working with a strength coach. So that's not bad. They might not be doing a ton of technical work. So you can drop that, and that's okay to add more volume. But maybe they have a demanding job where they have to like walk around a lot. So you fail to consider they work 3 days a week, standing and moving, 10,000 steps. And you added all this volume because you're in their off season, and their strength conditioning is also doing high volume. So you fail to consider how that coincides and correlates and accommodates their lifestyle. And maybe their ADLs, maybe they have a kid, and maybe they have to chase them around, 2-year-old kid, and they have to chase them around, or versus a teenager, whatever it is. You have to consider, what does this person do on a daily basis that then allows me as a physical therapist to accommodate and provide a better solution for them. So ultimately, you stop have to thinking about just their body region and their sport. You have to think about, what does a day look like? What is a full day of not just training, a full day of life happen? Like, what does that include? And then you have to look at, what does a week look like? And then from there, you can say, okay, great. Monday through Wednesday, you train. Thursday, you're off. Friday and Saturday, you train. And Sunday, you train. Perfect. Now I know your week. How often are you working out? Okay, working out Monday, Wednesday, Friday, Saturday. Great. And how often are you doing technical training and sport specific? Monday through Wednesday, Friday, Saturday. Okay. And then what are you doing Thursdays? That's completely off. Okay. When do you work? Oh, I work on Tuesdays, or I work on my off days, Thursdays and Sundays. For like, oh, then that puts a damper. Now you have to consider how your total amount of work that you're going to apply and adding to these programming from a rehab perspective, and blending that in with their strength and conditioning program. Or maybe they don't have a strength and conditioning program, and you're the one developing it. These are the things to consider. So now you know exactly where they are in season, out of season. Then you accommodate volume and intensity accordingly. But now you have to consider, what does their day look like, a full day? What does their week look like in terms of their ADLs and work? And then what are they doing outside with their coach or their strength coach? Now, when you put all those variables together, you now have a better idea of what a week looks like. And then when they're in season, out of season, you know what their quarters look like, or 3 to 4 month blocks look like. And this allows you as a clinician to have a better bird's eye view of how to manage an athlete versus just how to manage their knees, or just how to manage their hips. Just because you can rehab an injury from time of injury to plyometric testing doesn't mean they're fit to go back to sport yet. You still haven't worked on conditioning. You haven't worked on getting the essential strength as a well-rounded strength program to get them fit for their sport. And if you have somebody to help you with that, that's great. How does your rehab, that transition, that gray zone, how does that fit? And these are the principles that, after working with some of the best strength and conditioning coaches on this planet, around the world, with Olympic level athletes, they all say the same thing. I wish the physical therapist would. It would be great if they just don't consider me, they don't reach out to me, they don't know what I'm doing, I don't know what they're doing. And that's the fourth part. That's the fourth common mistake, is that you don't coordinate with their technical coach or their strength coaches to maximize the athlete's potential, maximize their outcomes. So if you Take worst case scenario. Before you listen to this podcast, you probably thought, well, I'm going to rehab this knee and we're going to get you back to soccer and I'm going to help build up your program. And I want you to train 3 or 4 days a week. You're going to start running 3 miles a day or whatever it is. And these are all the factors. What you fail to consider is, well, the soccer coach is saying, well, what about us? What am I going to do at practice if you're already doing all those things? How do I do this? What ball skills can I be working on? Well, what can I do from a agility and speed perspective while you're doing all those other things? And the strength coach, maybe they work with a private strength coach or somebody else, and they're saying, hey, well, like, what about me? Then I don't have a position. What can I do? Can I build up their like core strength? Can I build up their endurance? What can I do on the back end? And if you're the one quarterbacking, this phase of injury, you have to decide, who is it? Who's the one quarterbacking every phase along the way? Maybe you got them to a certain point and the strength coach takes them over, and then from there they give them to the technical coach, or the technical coach takes over because there is no strength coach, and maybe you need that. Ultimately, you have to decide, where are they in season, out of season? You have to decide how you're going to accommodate volume and intensity accordingly. Then you have to decide from there how they plan their whole day, how they work on their whole week, and what's that volume look like, and then how you're going to build that program together. When you put all those things together and then you communicate with their technical coach, their parents, or their coach, or their strength coach, you put that all together, it puts this beautiful synergy. And who wins? The athlete. The parents, the coach, and the strength coach will love you. You'll build more relationships. It'll allow you to be more successful. This is the application at the highest level. This is how it happens. Pro sports, it doesn't matter, but ultimately, you have to avoid those 4 common things. I'll say them again, just so you can stay on track. You fail to consider if they're in season, out of season, or preseason. You fail to accommodate the volume and intensity according to their time of year, and you fail to consider the total amount of work or training that goes into their ADLs, their work, their practice, strength and conditioning sessions. It's almost like you're treating on an island, and the only person that will suffer is the athlete, and that you're going to burn bridges. You're not going to be as successful, and then you fail to coordinate with the coach and strength coaches to maximize the athlete's outcome. Those are the 4 things that PTs do not do when they're programming for athletes. And if this is something that you want to learn about and you love it and you're just like, I want to see that other side of that bell curve, you have to attend my strength and conditioning summit. This is for physical therapists to learn how to apply these principles for high school athletes, collegiate athletes, professional athletes. It doesn't matter. If that is for you, then that's perfect. Just plan to attend that event. But nonetheless, make sure that you are taking care of athletes and you apply these principles. And if that's for you, let me know. Tell me how successful you are with it. Send me an email, Dr. Chris at drchrisgarcia.com. And I hope you enjoyed this episode, this content, and I'm excited to hear about your professional growth. I will catch you guys on the next episode. Take care.